My name is Dr. Randy Hyde. Amy and I are going to talk about how to behaviorally intervene with enuretic children.
Randy, how many children do you think that you've seen over the years that have wetting problems, whether it be day or night?
That's a hard one to estimate. Just simply because being a child psychologist and having a specialty with enuresis, it's thousands. I would have to say
Wow,
thousands.
Thousands.
Yeah.
And how many of those children would you imagine, or how many of those children can you remember have been to see the pediatrician or the urologist?
Most have seen their pediatrician.
Right.
That's usually the first step. Urologists, not so much, but people don't know where to go.
Right.
And so I've seen a lot go through those different programs. Some are effective, some aren't.
So in your opinion, what works the best?
A behavioral approach, according to research, is the most effective. It takes a little bit of work. Let me ask you a question. If you want to be good at something, what do you have to do?
Practice.
Yes. And that's what we teach kids to do. We put them in control. We put them in control of the depth of their sleep. And we have them practice skills that will help them to overcome nighttime and daytime wetting. Daytime's really pretty easy. We can usually turn that around in a weekend. Sometimes it'll take a couple of weeks, but that's pretty easy and pretty straightforward. The nighttime can be a bit of a challenge, but we teach children how to overcome this both consciously and subconsciously. Even as a psychologist, it's weird. It's amazing how it really works. But enuresis occurs in the fourth stage of sleep, the deepest stage. Then that's where kids sleepwalk.
Right.
And so, they can be walking and still asleep. Well, we take advantage of that. We just teach them what to do while they're sleeping. It's amazing. It works so well.